Ladies and gentlemen, you're in for a real treat tonight. I am Daniel Lobel producing the show, and I couldn't be more excited about the man you're about to hear from. Not only is he a board-certified chiropractor who attended Palmer College, the Harvard of chiropractic colleges, but he's also my personal chiropractor and my close friend. It is my esteemed privilege to bring to you a man who's such a natural at what he does, and what he does is so natural. He doesn't use surgical tools. He doesn't leave you with infections. He doesn't medicate you with drugs that you don't need. What he does is holistic and effective. Ladies and gentlemen, my good friend, Dr. Daniel Rudé.
Thank you so much, Daniel. Yes, it is very interesting. You mentioned that as chiropractors, we don't use drugs or surgical tools, but we do have amazing effects on the body. And our main tool is manipulation. We move the joints of the body, both the spinal and also extraspinal, the skull, the nasopharynx, as we're going to speak to about today, the hands, the shoulders. And in fact, I brought a comparison of medical education and chiropractic education to speak about just briefly as we kind of intro into our talk tonight. There's a lot of people in the public who are under the misconception that chiropractors aren't educated. You know, they call us quacks. But in this sheet, it shows the comparison of the hours of schooling that a chiropractor goes through versus medical education. And class hours, 2,887 for chiropractic education, and medical education, 2,756. And then we have additional clinic times, which focus on treatment protocols. We focus more on manipulation, kinesiology, which is the movement science, how to get people moving better. And they focus more on surgery and medications. And in total, to get out of school with that, $200,000 debt, we have 4,485 hours. And the medical school, in addition to the $200,000 debt, they have 4,248 hours. So in actuality, I have more class time than the medical doctor. We have a focus, which is a little different. You know, if you want meds, I can't give you medication. I can give you herbals or natural types of hormone supplementation and also manipulation and physiotherapy, but I'm not going to cut you. I'm going to open you up. And we are also licensed in 50 states, all the states of the country. And in fact, in Oregon, we can do small surgeries. We can do proctology exams and sign death certificates, birth certificates. In fact, there's a few other states that have what we call expanded scopes of practice. But in other states, the other 40 states, it kind of fluctuates between what we call expanded scope of practice and a basic scope of practice. In California, we are licensed to do x-rays and manipulation, also give herbal supplements, and do both spinal adjustments and extra spinal, which will include manipulating the bones of the skull and the feet. I like to say the feet have 26 bones, and as a chiropractor, Jewish faith, 26 is a big number. It's actually Yud K Vav K. It's the gematria, which is the number associated with different words, and it's the gematria of God. So the feet are very important. So if your chiropractor isn't adjusting your feet, you say, come on, turn on my God energy, adjust my feet. But a lot of chiropractors in different states don't do extremities. They don't adjust fingers and hands. In fact, in chiropractic school, we had a Dr. McDaniels. He was a fun extremity teacher. He adjusted the hands and the shoulders. And he said, there's no one in medicines that adjusts your extremities. If your finger goes out, you can't really go anywhere to get it adjusted. Chiropractors, if we just adjusted extremities, the feet, the hands, we would be doing so much good in the world. So that's just kind of a wake up to realize that we are educated, we have licenses.
Not quacks, but cracks.
That's right, not quacks, but cracks. And we're legit, and you can be feeling safe, when you go to a chiropractor's office, and especially one that's recommended. As you know, in other professions, from social work to dentistry, there's good ones, and then guys who just are let's say not as motivated to be their best, or they just won't hurt you, but they're not gonna make you sing, your body sing. So really my advice is to listen to friends, go to a chiropractor who is motivated and really passionate about his job, and also is an educator. Someone who's an educator, values information. They stay up to date with their profession, learn new things. Last weekend I was in Burbank for a conference, learning new information, and I'm going to expound part of that today. Our focus tonight is how to breathe better naturally, and during the summer months, as we're coming in June, July, people start wanting to get beach ready and exercise. And in order to exercise, as Danny knows, you got to breathe. And
I know.
We have conversations about Danny getting more exercise. And as a fire needs oxygen, so does your body. You have to burn those calories off, and you burn with oxygen. So if you're not breathing well, your exercise is going to be less efficient. So what is breathing? You got the mouth breathing, and everyone knows how to do that. You just, but the problem is it's not that effective. No. There's a few things that you miss when you mouth breathe. First, you have epithelial cells, ciliary cells in your nose, which absorb oxygen very well. So you can actually start absorbing oxygen just by stimulating those ciliary hairs in your nose. Also, there's adenoids, which fight infection. So when you nose breathe, you're actually fighting infection better than mouth breathing. And also, we have connection to the ears. And when you inhale through the nose, you actually expand the eustachian tubes and your parietal bones, the sides of your skull. So it helps open your skull, and your brain gets a massage. The spinal fluid around your brain actually opens and closes, and you get this nice skull open massage, which you don't get with the mouth breathing. So kind of like a lizard expands its parietal bones when it inhales, so do we when we breathe properly through our nose. We have a much more substantive skull opening. So very interesting what nose breathing does. And through the COVID and all the viruses of the winter, people can have trauma in those nasal passageways.
Happened to me, Dr. Dan. Ever since I had COVID, my breathing has been much worse through my nose. And I was never a good nose breather to begin with. Yeah. I'll tell you something very quickly. I don't want to take you off track, but yeah. Speaking of track, I used to run in high school, cross country.
Wow.
And I did terribly. I was always the last one, but the biggest problem I had that the coach would always tell me is that I wasn't breathing correctly. And no matter how many times they told me, I could never figure out how to breathe correctly. It's so important.
So important, yeah. So to help my clients with exercise, breathing is just a huge part. And there's an advanced specialty called cranial facial release, or CFR, which I'm trained in. And it's a extra spinal manipulation, which uses balloons to open the nasopharynx. So basically, here's a balloon, and there's an inflator, and we put a finger cot on top of that inflator, And then I use aloe gel in my office. So we put aloe gel on there, and we feed it through into the nasopharynx with a toothpick, and we put it into the nose. And that's a tough thing. You got to kind of go through easy into the nose. And there's 3 tracks in the nasopharynx. There's a lower, a middle, and an upper. And we start going through the lower, and we put it through. And with the patient's assistance, we can kind of move it in and get them used to the balloon in their nose. The balloon is your friend. We say that. And we open that passageway by expanding the nasopharynx with this air balloon. So we kind of close it down and then pop it open. Why this one isn't inflating. There you go. So just like that. And there's some amazing things that happen when that expands in the nose. First, the patient can feel sometimes a popping sensation. It's usually the ethmoid and sphenoid sinus. These are 3, actually, there's 2 of 4 sinuses around the nose. Frontal sinus, ethmoid, sphenoid, and then that mandibular one. So as you press and open, it'll open those little bones in that sinus, which sometimes have been closed for many years. And the sinus bones can be closed because when there's inflammation anywhere in the body, there's a laying down of collagen, or what we call scar tissue or adhesions. And those scar tissues get between the bones and stop their natural expansion and movement. So people feel immediate relief and expanded nasal capacity when they feel this inflation. It can be a little traumatic, and there can be a little bleeding initially, but just spotty bleeding. And that usually stops after 10, 15 minutes or so.
Maybe what you could do to calm people in those situations is make balloon animals.
Balloon animals, right. I usually use some doTERRA. I think I brought some. We use like a peppermint oil. Those doTERRA are really nice. They're a little plug for doTERRA. I'm a rep, but it's what we call edible grade essential oils. So when you have an essential oil and you're breathing it or putting it on your skin, you want to look at the ingredients and make sure it's something that is not toxic for your body. So in our office, we use edible grade essential oils. So when you're breathing, you're putting in, you don't have to worry that there's something that could be toxic to your body. Look at your shampoos and your creams tonight and make sure that, there's nothing too chemical sounding in those items. Because you realize when you put something on your skin or you inhale it, it goes through your dermis, it goes into your body. So you want to really make sure that you're as diligent as possible to open up and put things in your body that are good for you. They say Whole Foods is whole paycheck, but it's worth it. You pay an extra $1 and you get vegetables without pesticide. So I don't want any pesticide on my broccoli, but and you go in there and Whole Foods, people look better. They look healthier. So the
other argument, though, Dan, is when you get the food with the pesticide, you are getting more for your money.
You are correct. That's the comedic side, yeah. But anyway, plug for Whole Foods, plug for doTERRA, plug for me. So we want to really talk about a little bit more about the procedure on nasopharynx and kind of how it came about. Cranial facial release has been around since the 30s. They used to use kind of their finger or sticks up the nose. Chiropractors did, not many MDs, but it's been researched in the medical profession that it does help increase the nasopharynx expansion. They had nice research by Dr. A.D. Speransky, 1930s, an MD, and it was director of research in the Institute of Experimental Medicine, and he determined that this expansion helped open up the cranial, helped open the pituitary, the hypothalamus, helped the entire body be healthier because more oxygen, better alignment of the cranium. So when you're opening up the nasopharynx, you're affecting a lot of bones of the cranium. In fact, my patients will say that they kind of feel like their brain doesn't know where it's sitting because they feel more expanded. I tell them it's kind of like going from a 1-bedroom to a 2-bedroom apartment. You got a little more room to put your bike and stuff like that. So, make sure you're not too dizzy or something. But you can feel more centered too, because with expansion and better alignment of your skull, your brain can kind of sit a little easier. We also do some adjusting of the cranium if we notice some misalignment. When a person comes in for the exam for cranial facial release, we'll take pictures of their nose, front face, and see if there's any deviation of the nose. And you have to also realize that what we're mainly focusing in is the tissue and the sinuses in front of the skull. So people who talk about septal deviation, those are bones inside the skull. So we're really only affecting the skull through moving the soft tissue of the nasopharynx and the face, moving those tendons. But we're not actually pushing anything against the septum. That's in the skull, and that would be a different provider. I'm not licensed to go into the skull and move the septal bones. Just manipulating the sutures of the brain and skull through manipulation on the outside. So it's kind of indirectly aligning the skull without using a surgical instrument inside the septum. And I just had someone ask me today, should I go to a nasal surgeon to look at my septum first? And I said, as I talk to other people, I'd always do something less invasive first, more natural first before I looked at a surgery. I tell people you can always cut. The surgery is always available. Let's see if you can kind of heal more naturally first, and then if that doesn't work, next would be some kind of drug thing, and then surgery. So most people should realize that your body, 98% of the time, natural therapies are very effective. And that 2% of the time when you need drugs or surgery, definitely, if I'm in an accident, my arm's ripped off, don't take me to chiropractor, take me to the hospital, get it, cut up or sewed back on, and then give me drugs because I don't want to feel nothing. But, after that, we need holistic things to, have the body heal from that trauma. It's kind of like a fire department. When your house is on fire, you want the fire department in there with their muddy boots, their water, and you got to turn the fire, kill the fire. But after that, you don't want the muddy boots there anymore. So most of the time, your house isn't on fire. You need to, keep your house in clean and in order. And the same for your temple of your body, holistic, non-surgical first, non-drug first. And most of the time, for most things that ail people, pain, hypertension, cholesterol, a lot of change can be done holistically before you have to start doing drugs and surgery. So that's my plug on, chiropractic first, drugs second, and surgery last. And if a person's pushing someone to surgery, first, it'd probably be better to get a second opinion from someone who's non-surgical, just so you have a balanced input. You're going to make the decision, but don't rush.
Stay out of the chop shop as long as you can.
That's right. That's right. Boba Fett in the chop shop. That was a cool episode where his friend went to a chop shop, or she had trouble with arteries, and they gave her plastic arteries, and it was a pretty cool idea. The chop shops. Who knows what's going to come in the future? But let's get back to topic. So when we are doing the initial exam for cranial facial release, we'll do the photos, check alignment, and it's very interesting. People have trauma and misalignment they've been living with. We have them hold one nostril, inhale with that open nostril, and do a grading of how closed down it is, like 1 to 10, 10 being the most closed down. You can do that at home, and then hold your other nostril and try and inhale. And if you're, more than 50% or so closed down, definitely you should look at doing some type of cranial facial appointment, and naturally see if you can open up some of that ability to breathe, so you can use all the benefits of the nasal breathing with the ciliary epithelials, with the adenoids, with the opening of the skull, and all the natural protections that nasal breathing allows. Because, in this viral world of COVID, we want to breathe through our nose because it's a more of a guard with the adenoids, with the ciliary, with the smaller apertures, the nares pressing or pointing down. You can get, cleaner intake of oxygen than a mouth breathing, where it just, everything that's in the air goes right in your mouth and hits your throat, and you wake up with a sore throat, and hey, I should have been nasal breathing with all those people around me coughing and sneezing. So real important, check that breathing for yourself and see if there's some reduction. Also, try and clear your eustachian tubes. And you can do that by holding your nose and trying to force a little bit of air through your ears. And if one doesn't open, you have a eustachian tube blockage, and that can also be remedied through this cranial facial release, because we open up the nasopharynx, we also open up the eustachian tube, and you can have that pop and that release. It's not good to not be able to clear your eustachian tubes, especially if you're going to go fly in the summer months. When you increase altitude, you increase pressure in that nasopharynx and the eustachian tubes, and it can rupture an eardrum or cause pain in that eustachian tube. So definitely before you fly, make sure you can clear your eustachian tubes. You don't have any blockage in there to prevent possible pain and trauma. So we'll take the face alignment. We'll also look at the nares. And a lot of times when someone hasn't been breathing through their nose well, that you'll notice one nares is actually smaller. The nares is the opening of the nose, and one is larger. It's more dominant. So that's a key also, that there's been some long-standing trauma or problem in breathing. We'll also check to see their alignment of their skull on their body. Because as you inhale, use the diaphragm to suck air into the nose. And if your head is forward, your shoulders are rounded, you're not able to pull oxygen as well through into your lungs.
You're saying the Hunchback of Notre Dame was a bad breather?
Was a bad breather, yeah. Research shows the apices of the lung are about 25%, that upper area of the lung. And when the head goes forward, the shoulders round, we call that FHP, forward head posture, or kyphosis. A person isn't able to expand their lungs completely. About 25% volume is lost. And less oxygen, that can lead to early onset problems in memory function and other problems in their body, because everyone's designed to have their full oxygen lungs. Like, I'm Daniel's lungs, I'm supposed to have that amount of oxygen, and over time, if my oxygen is reduced, I'm going to notice it in my health. So definitely we check to make sure the alignment of the skull and the chest are sufficiently aligned to have full completion or inhalation of oxygen. We'll also check torsion of the body as we look at assessment. Sometimes the head is rotated or the whole shoulders are rotated, and that can also torque, as the research from the MD in the 30s, it can torque the pituitary gland and the ability of your brain to open as you breathe. If there's a torquing, then the parietal bones don't open completely, and you don't get that full brain massage, as we talked about, through the cerebral spinal fluid moving through, and also the lymph, which is that fluid that helps nutrify the brain. Remember, you have two circulatory systems. You have the arterioles with the blood supply, but in your brain, whether it has to be very clean, you have a different circulatory system, and that's the cerebral spinal fluid. And this fluid is extra clean, and it nutrifies the brain and takes waste products out of it and goes into the lymph system, which you have lymph nodules around your neck, and you have only 4 drains of lymph in your body. You have 2 drains underneath your armpits, and 2 drains in your groin. In fact, there's a fun weight loss tip we can talk about. You can put ice on your groin and underneath your armpits. And Danny, you can kind of do this tonight, and you can sit on your couch and watch TV and actually lose weight.
Sounds like you're pranking me.
I'm not pranking you. Awesome. It's called brown fat. We have brown fat around the lymph drains of our body, in the groin and the axillary, under the armpits. And this brown fat has to be kept at a higher temperature than the rest of our body. And if we forcibly cool it, our body will expend energy to try and reestablish the normal temperature of this brown fat. So
beats going to the gym.
Yeah, it's the brown fat weight loss plan. So, but we want to make sure that the lymph is draining. Some people can notice, excuse me, there's lymph nodules that are blocked. I'm just calling around. Man. It's a little prayer for drinking water. You want to make sure everything's blessed and holy that goes in your system.
Yeah.
But people notice there's nodules on their neck, little bumps, and that is lymph that's not draining properly, because some of those little tubules are either torqued because the head is rotated or the head is forward. So we want to make sure that lymph is draining into the axillary. If the lymph stays there too long in those little nodules, it can become infected. Infected lymph glands are no joke. Or it can become crystalline and actually very hard. In fact, we had a person come into the clinic with a golf ball sized lesion on their neck. Their lymph gland was just huge. So we sent him for an MRI, and the MRI came back and it was crystalline and there was no cancer in it. So we just slowly broke it up with ultrasound and a few other techniques. We used pulsed electromagnetic frequency, or PEMF, and slowly broke that golf ball lesion and got the lymph flowing again. And he was, greatly appreciated. He didn't look like some kind of zombie anymore, and could turn his head, and his lymph was draining back again. So we have to watch those lymph nodes, make sure our head is working right, aligned, and we're no torqued from our skull or our shoulders. And also our shoulders talk to our hips. When our left shoulder goes up, our right hip goes up, because we want to keep our eyes balanced with the horizon. There's a mechanism, a reflex, where our brain says eyes are tilted, so let's get your eyes leveled with the horizon. In fact, we're working with the camera today before the first video podcast, and I said, Dan, we're tilted, and we got our our planar alignment back.
Yeah, I did an adjustment.
You did an adjustment. That's right. So when that left shoulder goes up, the right hip will go up to compensate and bring the eyes back to level. So we want to not have that torquing, because if the shoulder goes up and then the opposite hip goes up, that means the spine has to curve. And we don't want any curves when we're looking straight on. The spine should be nice and straight. There are curves when you look sideways, and it's very interesting. The curves on the sideways spine are designed like a Roman bridge to allow the most support for our head. The average head, do you know what the average head weighs, Dan?
I mean, with or without an ego.
That's right. That is the ego quotient. But average head 10 to 12 pounds. But Daniel, you're a heavy thinker. I think you got about a 16 pounder.
Like a fisherman.
That's right. Yeah, but it's quite a heavy object we have to carry around, and our spine and our neck is designed with a 42-degree curve, so that weight of the head can be held better than a straight line. So there is some support on each segment. That's how a Roman bridge is designed. It's designed as you press down for the weight to be dispersed over each section of the bridge, and a round bridge or a curved bridge can hold a lot more than a suspension bridge without so much support. So our body is very, very cool. It does have that kind of Roman bridge design in your neck. So you have a 42-degree curve in your neck to hold your head without so much pressure on the skeleton. And there's a 40-degree curve in your thoracic, and then a 42-degree curve in your lumbar. So you want to make sure all those curves are supported. Like as I'm sitting here, I'm making sure that my lumbar curve has some nice pillow back in it, and I'm keeping it open, and my head is back, so I'm keeping my cervical curve. Because when I go forward, I lose that Roman bridge cool design, and my spine starts getting straight, and then I have a greater tendency to have wear on my discs. So that's another problem in our normal society, or our modern society. They call it tech neck. And when you're sitting and your chin goes below your fist, you're reducing that normal curve. So that's a fist check we tell our clients to do when they're sitting at the computer. Put your fist underneath your chin and make sure that chin is not going forward. It's also helpful to raise your screen so it's the middle of the screen's at eye level, and also to put like a support underneath your feet, like a foot wedge. So it helps you kind of stay back against your chair and not fall forward. Invariably, if you don't have a foot wedge, your feet are right on the ground, you're going to eventually fall forward. So so that's invariably. So on your podcast setup, we've got to make sure you get a foot wedge underneath your your captain's chair there, Daniel.
Absolutely, yeah.
So foot wedge is great. Doing that fist check, making sure those curves are good. So we'll also palpate the spine when we do the CFR to see if there's any swelling along the spine. We'll also do a thermography check. Very cool tool. Thermography is coming into play now a lot more in medical exams. And it's a cool thing. It just shows where there's inflammation or stress in the body, in the spine, particularly in our office, and can kind of lead us to helping our clients get rid of nagging pain. Because whenever there's pain, there's pressure on the nerve in the spine, and pressure on nerve over time will cause inflammation. So that thermography will pick that up and will help us kind of narrow into places where we can take pressure and inflammation out of our body and our clients. So we'll do that assessment. We'll also check a stress. We'll do something called a smart pulse. And the smart pulse is a cool tool. It sends a laser through the arteries of the finger. It's kind of like a pulse ox. You put it on that index finger, and it's about a 2-minute test, and it'll check to see if the arteries have cholesterol in them, if the tonus of the artery is flexible. Because if there's blockage in the blood supply, no matter how much oxygen we put in there, our bodies aren't going to use it as well as it should. So as a holistic professional, as a chiropractor, we want to make sure that physically you're as optimal as you can be, mentally you're as optimal as you can be, and then also chemically we want to make sure that you're getting your oxygen and you're not having cholesterol blocks in the arteries. The flexibility of the artery is good, and that smart pulse will show a flexibility meter on there. And if the artery is not flexible as we age, the tonus and movability of the artery can reduce. And then if there's a little plaquing or something, blood has a harder time getting around that plaque because the artery isn't able to expand for that blood supply.
Is the range on flexibility something like starting from stiff to contortionist?
Right. When I was in school, I was staying at the Oakwood apartments in San Jose, and the Cirque du Soleil group, one of the groups, I don't know which group it was, but they were staying there too, and they were by the pool, and I still remember, them putting their heads, behind their shoulders and then their ankles. It was amazing. I had never seen anyone so much of a flexible person. I'm sure their smart pulse score for arterial flexibility would be very good. We do recommend folic acid as a first support for increasing flexibility, as well as stretching and exercise and de-stressing. Stress can cause arterial stiffness. But real cool Nobel Prize that's been kind of quieted by the chemical companies, big farm. Imagine why, but 800 IUs of folic acid and 1,000 milligrams of L-arginine is like a natural like statin. It can help open up the arterioles, reduce cholesterol, and that with a good cleaner diet over time has been really helpful for my clients to increase their arterial score, getting better blood supply, better flexibility. So there is hope,
Don't trust big pharma.
Well, I don't know about that.
Anytime I hear that, I just imagine a giant farmer.
That's a good visual. Big pharma. I think of like old scary money and Swiss bank accounts. But big pharma has they're a business. They don't want to get you off statins. You're a good customer, so show them your hiney and start taking holistic things and get healthy naturally. So you can slowly get off that. But I definitely recommend you doing it with the supervision of a MD. You don't want to come off of statins or cholesterol meds too quickly. You want to do it supervised and slow. That's kind of the big key word for any chronic things. You want to just go slow. Start it, easy does it. Because your body doesn't get fat over time very quickly. Like if you eat 2 Snicker bars, you're not going to gain 200 pounds. So you don't lose that cholesterol and that weight overnight either. So easy does it. I wanted to kind of summarize with a few of the experiences I've had with cranial facial release. We have lots of testimonials on our website and YouTube channel. Very interesting if you want to take a look at some of those. But I've had, in general, I've been doing about 5-6 years. I added that to my practice. Some amazing relief. People who haven't been able to breathe through their nose in years, just with a couple visits, starting to feel that ability to take oxygen in through their nose, which is a tremendous feeling for someone who's been a mouth breather for years. Also, I've had some great success in aligning the skull in birth trauma. We had one patient who had birth trauma in their face. evidently the birth was a little traumatic, and their whole nose was torqued and their right cheek caved in. And through a series of the nasopharynx and adjusting of the skull, their alignment and depth of their face has been significantly improved. And they're just ecstatic. They've gone through life looking like someone has punched them in their face and their skull was depressed. And to seeing a symmetry and more normalcy in their face just over, a few months. So really, just amazing thing. So if you've had trauma and you notice your nose is not aligned, before you try surgical stuff, try holistic things. Get it?
Don't go straight for the face-off option.
That's right. Don't go straight for the face-off. Do some cranial facial release. Let me adjust your skull and start holistically getting yourself back. Because, it didn't take surgery to get that way. And a lot of times you get a lot of help naturally to heal. Your body's growing about 1 million cells a day. You want to make sure that those cells are coming into your body symmetrically as possible. About 1/7 of your body changes over every year. So you have a lot of ability to change this year, and you want to kind of take more responsibility for getting your body aligned, getting yourself breathing better, helping your arterial supply better, your weight to, fat to muscle ratio better. And think of yourself as a machine, and you want to make your machine better. Most people take care of their car much better, than they do with their bodies. They see the light that says check engine, they're running to see what's wrong and changing belts and lube and oil and stuff. And their body, when was the last time they did a check on their bodies? So as your holistic doctor, as your coach, I definitely encourage assessing now. Use this podcast to motivate yourself to live a life of awesome. It's a plug for one of my other friends who's doing a great podcast, Living Life Awesome.
Great podcast.
So Saul Blinkoff's great guy. Shout out to Saul.
Just had I think the woman who did the voice for Jasmine on the show.
Oh, really? Really? So podcasts are amazing right now. It's just an amazing growth of information, and YouTube. In fact, Elon Musk says, we can learn anything we really want to now on the media, and he kind of poo-poos a little bit about university education in some sense. I mean, for medical profession, you really can't practice on bodies. In my school, I had to dissect a knee from the skin down into the bone, so I knew when I was adjusting what the structures were like. You can't really.
You can learn that from a podcast.
Yeah. At least you wouldn't have the smell of the formaldehyde, which was initially just really traumatic for me. But towards the end, the end of the year of gross anatomy, I could eat a Snickers bar as I was dissecting. So little by little, you get used to whatever.
It's called gross anatomy?
It's called gross anatomy. Yeah, that's right. There's a reason it's called gross anatomy.
Lives up to its name, I guess.
Lives up to its name. Formaldehyde, old people smell, everything. But
who named that? A fifth grader? That's gross anatomy.
Yeah, you never get over that image of walking into class and you see cadavers, on tables spread out in front of you, 8 or 9 of them. And they're not pretty, they're usually bodies that have, been aged quite a bit, or, people who are street people.
That's a good business to get into, hot cadavers.
Hot cadavers, hotcadavers.com.
Are you looking for the hottest cadavers for your medical school? We only have dead supermodels.
Supermodels.
Yeah.
Oh, man. All right, so I want to end with just a little plug for this podcast. If you contact my office, phone 310-280-0600, mention you heard the podcast, you get a special discount, special rate on cranial facial release. I will also give you a discount on the initial exam.
He also gives free vitamin C pills.
Yes, we always have free Yummy C's, chewable vitamin C's, Maxi Health or Kosher at the office. Always available as a added, what's it called? A value added service. I took econ at UC Davis and they said you have to give value added services.
He doesn't monitor how many you take too. So if you ever, sometimes I take enough to break even on the whole.
That's right, the whole thing. Watch out for Norma though. She'll our front desk manager will watch you on that. Also available on our website, wellsourceforyou.com. We have a podcast site that's going to be visible. We can go to that. We're on Spotify and iTunes. It's been a pleasure, a privilege speaking it tonight, and stand tall and think good thoughts, as they say in Yiddishkeit, sein gut vertrage. Think good thoughts and it'll be good. Stand tall. Tony, was it, who's that big motivation guy?
The Tiger. I think you're Tony the Tiger?
No. Quantum healing.
Oh, I know. Tony Robbins.
Tony Robbins, not Tony the Tiger. Tony Robbins,
I still get more motivated by Tony the Tiger to eat Frosted Flakes.
He was great. They're great.
Can't deny the motivation factor there was huge.
No, but Tony Robbins, he says, try and feel happy when you're all hunched over and, So your posture does affect your mood and how you feel about yourself, what choices you make, when to go to sleep, what to eat. So visit your chiropractor. If you're not visiting me, go find a good one that'll help you stand tall, feel good about yourself, breathe better, and really, live an awesome life.
You make a good point there, Dan, right at the end, that, anytime you go to a haunted mansion, the guy answering the door is hunched over like, Igor or whatever. Right. They're never living their best life.
They're never living their best life. All right. Have a great night, guys. I'll speak with you soon.
This has been a production of The Podcast Bus. Visit thepodcastbus.com and come in and start creating today.